Hey everyone, in this lesson we're going to talk about hepatic stigmata or the signs and symptoms of liver disease. To begin, one of the most commonly known signs of liver disease is jaundice. Now, jaundice is due to hyperbilirubinemia. Now, bilirubin is a breakdown product of heme catabolism, and normally the liver deals with the bilirubin and it actually will excrete the bilirubin in bile, but if the liver is not functioning properly, bilirubin can start to accumulate, leading to hyperbilirubinemia, and bilirubin tends to bind to elastin, and elastin is found in our skin, and that's why we get this yellowish hue in our skin. Now, a related sign of liver disease related to jaundice is scleral icterus. Now, scleral icterus is, you can think of it as a jaundice of the sclera or the whites of your eyes. The whites of your eyes become yellow, and this is again due to hyperbilirubinemia. And again, there is actually elastin in your sclera of your eyes, and the bilirubin binds to the elastin, and this is actually one of the first areas to display yellow staining. It is one of the first areas to display or to signal an issue with the liver. Now, another hepatic stigmata is ascites, and ascites is a collection of fluid within the abdomen, and it is due to hypoalbuminemia. Now, albumin is a highly abundant protein within our blood. This protein is actually produced in the liver. So the function of albumin in the blood is to lead to colloidal pressure and actually draw interstitial fluid back into the blood. Now, if the liver is not functioning properly, we do not get albumin produced in enough quantity, and this actually leads to hypoalbuminemia, which actually leads to a decreased or reduced ability of the blood to actually pull back a lot of interstitial fluid back into the blood, and we see large accumulations of fluid within places like the abdomen, and also we see places like the periphery, and this is why we see peripheral edema as well. We get a fluid accumulation because we do not have enough albumin in our blood to pull back some of that fluid, some of that interstitial fluid. Now, another stigmata of hepatic disease is bruising, and bruising is due to a decreased level of clotting factors. Now, there's several clotting factors that are produced in the liver, and when the liver is not functioning properly, we see a decreased production of these clotting factors, which leads to bruising. The next sign or symptom of liver disease is pruritus, and pruritus is due to retained bile acids. Now, pruritus itself is actually itching, and what we see is that because of instances where there is cholestasis, there is not adequate excretion of bile because of some problem of cirrhosis or some mass in the liver, which is suppressing or reducing secretion of bile. We get this retained bile acids. These retained bile acids cause this sensation of itching, and this is why we get pruritus. These patients often get excoriations as well from itching so much. Another stigmata of liver disease is palmar erythema. Now, palmar erythema is simply a reddening of someone's hands, and it typically, or the palm of someone's hands, and it typically affects the hypothenar border, the area opposite to the thumb. And in this picture, you actually see here where we see a large reddening in the hypothenar area. And palmar erythema is not only associated with liver disease, is also associated with other conditions. And one of the other conditions we see this in is rheumatoid arthritis. Another one is purpura. Now, purpura itself is simply red little spots. And you might hear of petechia, you might hear of purpura or ecchymosis. They're all just the similar red spots, but in different sizes. And now purpura or petechia is due to or related to thrombocytopenia. And thrombocytopenia is just lower than normal levels of platelets in the blood. And a lot of times platelet suppression in liver disease is secondary to a splenomegaly. So in liver disease and cirrhotic liver disease, or any other liver disease where it causes a portal hypertension, we see that there is a backup of venous return from the spleen to the liver, leading to an enlarged spleen. And the spleen actually can take care of and degrade platelets and on actually red blood cells. And when we have an enlarged spleen, it can actually start to degrade too many platelets. We then get a thrombocytopenia, which can then lead to petechiae purpura in these patients. Another sign of liver disease is muscle wasting, and liver disease itself, a chronic liver disease, is a catabolic state, which leads to a lot of muscle wasting in different areas of the body. A lot of times you'll see it in the hands, and sometimes you can also see it in the temporalis muscles as well, on the forehead. These areas of the head can actually see wasting. Another sign of liver disease is xanthelasma. Now, xanthelasma itself is simply a buildup of fat around the eyes, and it's a yellowing kind of accumulation of fat around the eyes, and it's more related to cholestatic liver disease. Another one is bronze diabetes. Now, we call this bronze diabetes because of the discoloration in the skin. And this, you can see here in this image that you can see quite a difference in the coloration of the skin in these patients. And bronze diabetes is known as bronze diabetes because of the discoloration, and it's associated with hemochromatosis, which is a genetic condition leading to an iron overload. These patients have high iron levels, and it's called bronze diabetes because of the fact that these iron deposits of iron actually occur in the pancreas as well, which leads to problems in insulin production and secretion, leading to diabetes. So in these patients, you see not only a bronzing of their skin, but you can also see diabetes as well. Another hepatic stigmata is leukonychia. Leukonychia is a whitening of the nail bed. You'll see normally it's usually pink or red, but in these patients you see a whitening of the nail bed, and this is related to hypoalbuminemia as well. Another stigmata is nail clubbing. Now, nail clubbing itself, you can see here these patients, their fingers, you can see there's a change in the angle of the nail in these patients. And nail clubbing itself seems to be related to hypoxemia. It's typically a sign of respiratory problems. So you can see nail clubbing in respiratory diseases, but you can also see it in liver diseases as well. Now, an interesting phenomenon you might see with liver disease is known as asterixis. And what happens is if you get the patient to put their arms straight out in front of them and put their hands up in the air, pointed like in such a way like this, as you see in this diagram here, what happens is if you get them to close their eyes, you will see that they will actually drop their hand, and then they will immediately bring their hand back up. And we call this a tremor flap, and this tremor flap occurs at the wrist. And it is bilateral, so it happens in both hands, and it seems to be related to any type of metabolic disease. It doesn't necessarily have to be liver disease, but it can happen in other metabolic diseases as well, such as issues with the renal or respiratory systems. And the cause of asterixis is not entirely known. It seems to be due to an interruption of a postural pathway in the reticular formation, which leads to this type of tremor flap. Another stigmata of hepatic disease is caput medusae. And caput medusae is this kind of engorgement or dilation of veins near the umbilicus of the patient. So if you look at their abdomen, you might see this kind of engorgement of veins leading from near their umbilicus or their belly button. And this is more specifically a dilation of para-umbilical veins. And you'll see that it'll actually radiate away or radiate from the umbilicus. And caput medusae itself is a result of portal hypertension, leading to a backup of blood into these veins, leading to this engorgement of these paraumbilical veins. Another sign that you might see with these patients is hepatomegaly, which is just an enlarged liver. We know that because if in a patient with liver disease they can get vascular swelling, inflammation, it actually leads to an enlarged or an increase in size of the liver. And this is how you can actually see these patients with an actually distended abdomen in a certain area in the right upper quadrant. You'll see this enlarged area of tissue, and this is actually hepatomegaly. Another stigmata of liver disease is spider nevi, and spider nevi are simply just dilations of blood vessels, and they kind of lead to a radiation of vessels, and this is why it's called spider nevi. It kind of resembles a spider's web or a spider, and the dilation of the blood vessels is actually due to high estrogen. Now, normally the liver actually metabolizes and clears estrogen, but in liver disease, there is reduced clearance of estrogen, leading to higher levels of estrogen and leading to spider nevi, or the dilations of these blood vessels. And this leads to another stigmata of liver disease, and that is gynecomastia. It's enlarged breast tissue in males, and this is again due to increased estrogen, due to reduced clearance of estrogen by the liver. And now this is another sign of liver disease, but it's not necessarily only due to liver disease. It can be due to other hormonal issues as well. It can be due to increased estrogen just because of increased peripheral estrogen production. But you could see this as a stigmata of liver disease. Anyways, guys, that was a lesson on hepatic stigmata. I hope you found this video helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.